Hello. Oh, nice. We already got folks in the room. Good evening, everybody. Welcome to Career Night. We're going to get started in probably like another minute or two. But if you are just joining us, feel free to drop in the chat where you're joining from. I didn't tell you this, Dr. Miller, cold Florida. I can say this now.
So what's going on in Florida right now?
We had a cold front, and I thought this is how I'm going to die. This right here. We got down to like 50 something, and that was yeah. You gotta laugh.
Yeah,
Like
so
that's
people in like Maine and Massachusetts, like they're
yeah.
they're they're just like, did you say minus 50?
Nope, nope. Just 50. Someone just said they're in Connecticut, so I'm sure they're like 50 degrees. Get out of
Mm-hmm.
here, ladies.
Oh,
I'm
listen, we're cold like you here in isn't there like snow in half the country or something?
I think so.
Isn't there a
I'm
lot of
like,
weather on the way?
what
Let's see, what
the
does the chat say? What are people in the chat?
Ah, it's my volume again.
Uh,
Okay, well, while we have a minute, I'm going to switch my microphone and let's
oh, we
see.
got Rhode Island, Texas, Connecticut. I'm in Nevada. We have Utah. Oh, starting to snow in Utah, Oklahoma, Arizona. Dang, what if we get all 50 tonight?
Can you imagine? All right. I'm gonna just
Okay, that's way worse.
way worse. Okay. Wait. How about now? How's that?
Keep talking. Let's see. Try
Is
talking
that
some
any
more.
better? Any better?
It's hard to recite like the Gettysburg Address or something so we can hear
Oh,
you talk a
sure.
minute.
Let me just pull that up.
Oh, how
Alex
about
says much better. I think, let me just move closer to here. I'm just goofing. Okay, Charmaine says better. Sally, can you hear me okay?
I can hear you okay, but I think it sounded better before you did whatever you did.
Dang it. Oh, Michelle, the podcast listen. All right, I'm going to do one more thing and then I promise I'm going to stop goofing around with my mic. I'm trying to figure out why. This is why I think I'm cool with technology, but I'm not.
We have California, Virginia, all these states are popping in.
I know this is great. Sacramento. Nice. All right, let me do one.
Now I'm having a hot flash. We were talking about the cold, but it's the eternal. I thought menopause was supposed to be over after you turned 60, but apparently it is not.
Not so much. All right, I'm gonna say, here's my mic, here's my mic. Oh, dang, I have an echo. All right, let me turn this off and stop.
Echo, 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 echo.
All right, I think
I'm not getting an
nice
echo.
now.
That sounds good to me.
Am I all cool now?
Yeah, I think you're clear.
All right, great. So I only had to unplug and plug in 80,000 things. Welcome, everybody. All right. This is the best last message. Menopause never ends. I think this is what we should title our event right now. Menopause never ends. I agree.
That's just such a defeatist statement. You know?
Well, welcome everyone. We're super excited that you joined us tonight. If you have not seen us before, us very famous people of FHEA, just joking. I'm Jonna Emil, I'll be your host, and joining me is Dr. Sally Miller, one of our amazing FHEA faculty and doer of all things NP is truly what I think your title should be. Thank you for joining, Dr. Miller.
It is always a pleasure.
Awesome. Okay, so tonight's a fun night because we are going to talk about kind of demystifying the whole process of applying for your boards. And so I know Dr. Miller has a really funny story, which she'll get to. I actually am really into this conversation because as you guys know, right, I'm an RN. I think about when I had to like do the thing to get licensed, right? Take your boards, get licensed. And I really feel like there was only like two things that you had to do, right? You had to graduate, you had to apply for your board, you had to apply for a license. And I was broke like a joke. So I remember I had like zero money to actually pay for the things. And it was really confusing. Even just those two things was pretty confusing. So really interested to have this conversation. Just a little housekeeping, as our moderator has put in the chat, Erica. If you have any questions at all that come up during this time, go ahead and drop them in the chat, drop them in the Q&A. We're super happy to answer that for you. And then at the last like 10 or 15 minutes, we'll check the questions and we'll answer all the things and make sure that we have a good dialogue here. So first thing, Dr. Miller, this process is confusing. I have counted 5 things, and I might be counting wrong, that you have to do as an NP when you graduate. Like, so you graduate, in my brain, you're taking the boards, you got to apply for licensure. NPs have this NPI thing you need to have. Then you have a job. I think there's like a contract, and then there's a DEA and the training and all of these things. So help us to make sense of this. If you are an NP, you're getting ready to graduate. So now, like, all right, I'm on the fast track to licensure. What do we have to know? Step 1.
So it is confusing, and I hate to sound pedantic for anybody who's listening and they know this and think I'm like, being way too basic, but it's confusing and it's not the same for everybody. And the reason that I have a particular interest in making sure this is very clear to everyone is that, as I was telling you a few minutes ago, when I finished school, I practiced as an NP for 2 years without being licensed to do so. And the only reason I freely admit it now on a taped podcast is that I believe if there's any statute of limitations, it's expired by now. I mean, because ignorance is no excuse, right? Ignorance is no excuse for not following the law, but we just didn't know. So let me tell you my little story, and then we'll tease out from that what everybody here wants to know going forward. So, like everybody's an RN first. And as an RN, yes, you finish school. And then some of us who was RN a really long time ago, we took a 2-day pen and paper examination. But those of you that weren't that long ago, you took a computerized examination, but we had to graduate. We had to submit evidence of our transcript. We had to pay money, fill out an application to the board. It was all very important and very official. And we had to have like a stamped transcript from the school and all that verification of our graduation. And then when you went to take your test, it was like all, you couldn't take in any of your own implements, and they made you empty your pockets out and check your glasses for secret cameras. And then they put you in a little cubicle and you take your test and then you wait. Well, no, you got your answers right away. But it was all very formal and important, and you had to verify everything and all that kind of stuff. Well, when you take nurse practitioner certification boards, it feels the same way. But a really important difference is that nurse practitioner certification boards are not issued by a state licensing organization. State licenses give us our RN licenses. The organizations that confer our certification are not state boards. They are national organizations, the American Association of Nurse Practitioners or the American Nurses Credentialing Center. They are not agencies of government. They have no articulation to boards of nursing, nothing. They are their own professional organizations, and they have a certification division. But in order to take your certifying exam, the process you go through looks very similar to the process when you took your RN boards. You have to have like this application has to be verified by the school. You have to submit a transcript that shows you graduated. You pay a lot of money. You get assigned to it. You pick a center. When you go to the center, they check your pockets and check your glasses and make you put everything in a locker. You go in and sit at a cubicle and take your test. It feels a lot like your RN boards, but a really, really important difference is nurse practitioner certification examinations. Like those exams allow you to be certified by a national professional organization, not an entity of the state. So being certified by AAMP or ANCC doesn't give you the legal right to do anything. It's not a legal conferral. It just means that you have met that organization's requirement to be certified by them. You met the educational requirements, you took their test, you paid them money, and you passed your test, and then they certify you as a nurse practitioner. They're not licensing you. So having that certification only means that you met the requirements of AAMP or ANCC. As luck would have it, 47 out of 50 states require that you have that certification as part of your licensure application.
So there are some states that you don't then.
There's only 3 left. There used to be a lot more, but there's only 3. And I believe it's California, New York, and Kansas.
Yeah.
Those 3, you don't have to take NP boards to be licensed by the State Board of Nursing. So in New York, Kansas, and California, those states, and many others actually, because lots of others used to do it the same way, you didn't have to take national boards, because just by virtue of graduating from a program approved by that State Board of Nursing, you were eligible to practice as an NP. Like in those states, if a school wants to start a nurse practitioner program, they have to assemble the entire curriculum, and I mean in detail, the curriculum, the sequencing, the objectives, the content, blah, 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 fill out a zillion forms, present it to the Board of Nursing, and the Board of Nursing has to approve it. And it used to be in most states, if the Board of Nursing approved the program, that was all they cared about. They didn't care if you had a national certification or not.
Wow.
But as the years have evolved, the LACE model, which I hope our listeners at least recognize the LACE model, licensure, accreditation, certification, and education, that evolved in 2008. And that was the first attempt to try to unify the licensing entities, which are state boards of nursing, the accreditation organizations, which are CCNE, which accredit schools, C for certification, the certifying boards AAMP and ANCC, and then E, educational institutions, schools of nursing. The LACE consensus model had made an effort to bring consensus to all of those separate arms that were involved in being an NP, because before the consensus panel got together, all 4 of those things were just doing their own thing. Like the State Board of Nursing, they had their own requirements. And then schools of nursing had their own requirements, and accreditation institutions had their own requirements, and everybody had their own thing, and nobody was really playing nice together. Just for instance, many schools of nursing only required I'm sorry, let me set that backwards. Many boards of nursing would only require like 300 to 500 hours of clinical experience to be an NP. But many schools of nursing required more than that, 700, 800, because they just thought it was better.
Yeah.
Mind you, there was no evidence to support that. That was just, they thought. So you'd be like, yeah, so like the Board of Nursing only made you have this many. Schools of nursing said you have to have this many, but you have to graduate from an accredited school. Every Board of Nursing application requires graduation from an accredited school.
Yeah.
And to get accredited, you have to do what the accreditation organizations say, which is something else entirely. But I went to school before the first NOMP task force guidelines were ever even published. So nobody knew what anybody was doing. So what happened to me was when I finished school, and my program, it was just bad. It was a joke. Like they didn't know what they were doing, but nobody was regulating it, so who cared? So when we finished school, our faculty passed out these applications from the American Nurses Credentialing Center, because at the time they were the only ones certifying NPs. So they passed out these applications and they pre-filled them out, verifying that we finished the program. And they were like, okay, you need to finish filling this out and then send money, and here's your transcript, and that's how you take your boards. So we were like, okay. So, we filled it out, we paid money, we took boards. We went to the center, we had to get checked out. We couldn't, number 2 pencils, even my NP boards were on paper. But it just felt just like a State Board of Nursing RN exam. And then 7 weeks later, which is the way it used to be before computers, 7 short weeks later, I got my little card in the mail that says, this is to certify that Sally Kathleen Miller is certified by the American Nurses Credentialing Center as a nurse practitioner, blah, blah, blah. And it looked very official, so I thought I was an NP. So I went and applied for a job at a hospital. And I went and interviewed. and I was being hired by the Department of Medicine. And they said, "Are you an NP?" And I'm like, "Yep, here's my card." And they said, "Great, you're hired." And I got a job in the hospital. I was like the only in-house person managing this service. So I was like running around, admitting people, discharging people, changing meds, converting from IV to PO or vice versa. Like I was functioning like a resident without a teaching service behind me. And I did that for like 2 years. And then I had the opportunity to apply for a teaching position. So I went, to the interview, and they wanted to offer me the teaching job. So I went to HR, and they're like, "Okay, we need your license and blah, blah, blah." So I showed them that little card thing, from the American Nurses Credentialing Center. And they were like, "No, we need your license." And I said, "Oh." So I gave my RN license, and they were like, "No, we need your nurse practitioner license." And I was like, "Oh, that's the one I want to know."
I left that in my car.
So I never told a lie. I did not lie. I stuttered and stammered and didn't complete a sentence,
Oh no.
and said that I would make sure I get it to them. So I went home and I called the Board of Nursing and I said, "Excuse me, do I have to have a separate license to be an NP?" And they said, "Yes." And I said, "Oh, well, could you please send me that application? Because this really was before you could download it. I mean, there was very rudimentary internet, but
Yeah.
people didn't use it like we did now." So they send me an application. And now the fun part was I was applying for licensure in a state other than the state I went to school in. So
Okay.
the state had not approved my program. I went to school in New
Oh.
Jersey. I was applying in Pennsylvania. So I had to submit like everything but my firstborn child. They wanted copies of syllabi and stuff
Oh
for my
my
program.
God.
I get together this like 2-inch binder with little tabulations for everything they wanted. I sent it off with my $50 application fee. And meanwhile, I'm getting calls from the university who's trying to hire me. Thank goodness they hire like ahead of semester, like I had the whole
Yeah.
semester to work this out. And they're like, "Oh, Miss Miller, we're just waiting for your license." I was like, "Oh, yeah, I've been in touch with the board. It's not, you know what? Let me call them right now and I'll get back in touch with you." And like I said, I never told a fib. I just didn't actually fully answer a sentence. And I'm waiting and waiting, and like weeks are going by, and I didn't get my thing. So I finally called the state board, and I swear you could not make this up. After they cashed my check, there was a fire in the Hall of Records in Harrisburg, Pennsylvania. Google it. It was like 1995, 94, 95, something like that. They burned up my application, my 2-inch thick application of everything I had assembled. And they were like, "Can you send another one?" I said, "No, I can't send another one." I said, "But you cashed my check. So obviously someone reviewed it and determined that it was acceptable." And they said, "Oh, okay." And they gave me a license.
Oh my gosh.
So I don't know if I ever actually deserved a license or not, but that's how I got it. And as you can imagine, I made sure I held on to it ever since. But I still run into trouble. Like even now, if I want to apply in a different state, of course, now in the last 30 years, everything has become so formalized that I have applied to states where my transcript doesn't say pharmacology, pathophysiology, like things were structured differently. Like I said, this was before a NOMS task force guideline was out. And so I have had some trouble. I mean, I'm licensed in several states now, but I've had to jump through hoops.
Wow.
It's all kinds of stuff just to demonstrate that I'm so I don't want anybody now to be practicing without a license like I did. Thank God. I mean, nothing happened to anybody,
Yes.
So the first thing everybody wants to be really, really clear on is the difference between certification and licensure. And like I said, it's confusing because some states, I don't know why, but some states actually call their official legal authorization to practice a certificate.
That's confusing.
Like in New York State, where you don't have to have board certification.
Yeah.
In New York State, you are licensed as an RN. And if you then meet their criteria to be an NP, you have a certificate issued by the board appended to your license.
So that is your license. It's just like
It's
when you have a black belt, you
it's
get one
basically
more
like your
stripe.
license with a rider. It's like if you have a driver's
Yeah.
license, but you
Yeah.
also have a motorcycle
Yeah.
waiver.
Okay. So it's just like an
And they
add-on.
call it, but they call it a certification, which makes this whole thing a real booger.
Yeah.
Now, if that's not enough to be confusing, even if you live in Newark, California, or Kansas, you want to take the certifying exam anyway, because not only might you move at some point in your life
Yeah.
and want to go somewhere where you need certification by the ANCC or the AAMP, but many insurance companies now require it to
Mm,
impanel you. Like I have a colleague who was a psychiatric or is a psychiatric nurse practitioner, but was licensed by the state years ago before certification was required, like here in Nevada.
yeah.
And so while he is licensed to practice as a psych NP, not only is he not certified by the ANCC or AAMP, but he doesn't meet criteria to apply for certification
Oh,
without
God.
going back to school. So now, if he wanted to be certified after practicing for over 20 years in the specialty, he would have to go back to school and do clinicals in that specialty.
Oh my God. Yikes. Okay.
So, so
Now, yeah, that's crazy. All right.
mhm,
So certification, licensure, not the same thing. Certified, that comes from the bodies, right? Those bodies like
mhm.
AANP, ANCC we spoke about. And that's based off of the specialty exams, right? Like that can depend on
Yeah,
which
they
one you want
right.
to take.
FMP or
Right,
Psych MP or adult
right.
neuro, yeah, acute care, whatever.
Right.
Mm-hmm.
And then licensure is your license to actually practice. So lovely that you have the certification, Dr. Sally. Where's your actual license? Something completely
Exactly.
different. So let me ask then, which one comes first, or is that not a thing? Does it matter? Do I have to have my license
Well,
first, certification first?
no, the in 47 states, you have to have passed a board certification to be eligible for licensure.
Got it.
So here's what people want to do. Like when you finish school,
Yeah.
first thing to do is go to the website for the State Board of Nursing in which you want to practice. Not necessarily where you live, but where you want to practice. If you want to practice, if you live on a border and you want to practice on the other side of the border, you want to get licensed where you are going to practice.
Yeah.
So first thing you do is get your license application. And the application will say, did you graduate from an accredited school? Please have a transcript sent. Did you have X hours of pharm and patho and assessment and this and that, and fill it all out. And some of them will say, give us the names of the courses. And then they'll say, pay us money. And 47 states will say, include verification that you have passed a certification exam.
Got it.
So in order to even submit a completed application, you have to have passed your certifying boards. So you will simultaneously go to the AAMP or the ANCC website and download their application for certification. And it will look very much like the application for licensure that you just filled out from some state board of nursing. It will say, send us your transcript, tell us about your coursework, send us money, send us more money. And then what else will it say? Send some more money. And whatever they want, but it looks a lot like an application for a state license, but it's not. So then you do all that, you get authorized to take your boards, and then you have to pay them to a fee to send a copy of your pass directly to the Board of Nursing.
Okay.
And then you send in the rest of the application to the board. Once you verify that you have successfully completed a certification, then you can get your license. Now, some states allow for almost like the same thing as a GN. Like some states will allow you to practice as an NP pending your boards.
Yeah.
Like Nevada will let you practice, but you cannot prescribe.
Okay.
And then, of course, everybody says, well, how are you going to practice if you can't prescribe? Well, you can still examine the patient. You can make a diagnosis. In most new jobs, you're working with some sort of mentor or something anyway. And then ultimately, the mentor is the one that issues the prescription. But you can still get experience in seeing the patient, examining the patient, forming a differential, coding it, charting it and coding it appropriately and stuff like that. So every state's different, though. You have to check with the State Board of Nursing where you're going to practice, what, if anything, you are authorized to do while you're pending your full NP licensure. And then, again, every state is different, but many states have some restrictions about controlled substance prescribing in the first year or so of practice. So you want to be sure that you're familiar with that. Some states will allow you, once you're fully licensed as an NP, immediate prescribing of anything except C2.
Okay.
C2 like opioids or psychostimulants. And that works for a lot of people because a lot of people don't want to prescribe them anyway. But if you do work in an environment where you might need to prescribe a Schedule II controlled substance, that's the one thing that you have to usually have some sort of supervision or agreement with. But that really varies from state to state.
Okay.
So,
Okay.
but before we even go any further, so like let's leave it at the first thing you do, decide we're going to practice, go to the Board of Nursing website, get the application for licensure, and give them whatever they want. And 47 of those boards are going to want verification of passing your certifying board examination. So that's why you have to go to the certifying website and fill out the application to take your certification exam, which is what we at Fitzgerald help everybody get ready for.
Yep. That, nursing has an uncanny knack to make things wildly confusing. All right, so we got certification, licensure, not the same, two different things. We have 3 state exceptions. So that's really important to know. Now you started talking about prescribing. There's a whole prescribing part of this, right? Like you need to have a license, is that the right word? To be able to do that. Like you have to be able to do that. So when does that come?
Every state's going to have slightly different tweaks on this, but typically, if you are licensed as a nurse practitioner, that generally that suggests or it implies that your state board of nursing has determined that you have met the necessary criteria to be a prescribing provider.
Okay.
However, some states require that you then apply to the Board of Pharmacy for a Board of Pharmacy license. And it's the Board of Pharmacy that actually authorizes you to prescribe, dependent upon the Board of Nursing verifying that you meet eligibility.
Okay. So is that something then, same thing, it's like depending on the state that you're in, make sure you know what the rules are for that. Oh gosh. Okay. And is that the NPI number? Or is that something different? What's that?
Nope. Well, but there's one more thing about prescribing.
Okay.
Since we're having a building curriculum here.
Yeah, just for the record, I am no longer interested in NP.
I mean, listen, it is an enormous pain in the beginning. I mean, the first time around, yeah, just,
It's a lot
grab
to
a
know.
cocktail, relax, and just do it, So when you apply to the State Board of Pharmacy for authorization to prescribe or licensure to prescribe, some states then make a distinction between the person that prescribes legend drugs or the person that also prescribes controlled substances. Legend drugs are things that you need a prescription, but it's not a controlled substance. Antibiotics, proton pump inhibitors, antihypertensives, everything else, like all the day-to-day stuff,
Yes.
They're legend drugs. They require a prescription. So you need to be authorized by the Board of Pharmacy to prescribe them. But controlled substance prescribing is yet something different. Controlled substances are, well, they're controlled. I guess that's why they call them controlled substances. And controlled substances come in 5 flavors: C1, C2, C3, C4, and C5. C1 is not available for prescribing. Those are for research purposes only, so they don't matter to NPs. For NPs, what matters are C2, C3, C4, and C5. The lower the number, the more tight the control. So C2 is the most tightly controlled substance that we will prescribe. That's your oxycodone, your hydromorphone, morphine, all that kind of stuff. So many state boards of nursing, when you apply for a license to prescribe, if you specify that you are going to prescribe controlled substances, that's it's another appendage. It's another piece of your license. Because in order to prescribe controlled substances, many states require like additional CE phenomenon.
Mhm.
So if you're going to prescribe controlled, when you apply to the Board of Pharmacy to be a licensed prescriber, on the application somewhere, it will ask you if you want to prescribe or if you're going to prescribe controlled substances or not. Even if you want to prescribe Lyrica, which is, an anti-epileptic that we use for, well, not really for seizures anymore, but anxiety and um, uh, mostly social anxiety and general anxiety and stuff like that. Neurontin, which we use for neuropathic pain.
Yeah.
Even some of the cough medicines with opioids in it, they're all C5. Sleeping pills, Ambien, Zoloft, they're C4. So if you want to prescribe any of that, you need to be licensed as a prescriber of controlled substances. So don't just think, oh, I'm never going to give opioids. I don't need this. Any controlled substance.
You definitely need to have that.
So,
Okay.
and then just one more.
Go for it. Go for it.
Once you are licensed by the state Board of Pharmacy to prescribe controlled substances, then you need to register with the DEA. And that's yet another exercise where you go online.
Once you're licensed, right?
No, the DEA is a registration. The Drug Enforcement Agency, they're not a licensing body. They don't give you the authority. They just register you as a prescriber of controlled substances after the State Board of Nursing licenses you. Like the DEA, I don't really know exactly what they do for us prescribers, us individualized kind of prescribers, but it's a registry. It's just a registry.
Okay.
The first thing they ask you on the application, but you have to have it to prescribe controlled substances, but it's just a registry. And one of the very first questions on the application is, are you state authorized to prescribe controlled substances? Because if you're not, you're dead in the water. You can't get a DEA registration.
And that's why that is important for what you spoke about earlier, like having, if it's pharmacy requires you, or the Board of Pharmacy requires you that, or just something that automatically, you need to make sure that you have those pieces.
You need to do all of these yourself, right?
Yes.
Yeah. So first you get a license. In order to get a license from the Board of Nursing, you'll probably have to pass your certifying boards. Once you have that, then you apply to the Board of Pharmacy to be a prescriber. If you are going to be a prescriber of controlled substances, you then also have to register with the DEA. And then if you can still afford it, you can take the bus to work and prescribe stuff.
Okay, that's a lot. So certification, licensure, pharmacy board, DEA, so you can do the thing. And then there's a training too, isn't there, that's attached to this? Because you actually teach this.
Oh, there sure is. Yes, we know about that. So
yeah.
As of July or June 23rd of 2023, the DEA now requires, in order for you to either become registered as a new applicant or renew your registration, which you have to do every 3 years, in order to do either one of those things, you have to meet a very specific 8-hour educational requirement that is relative to the prescribing of controlled substances, the screening of patients for risk for abuse, diversion, and overdose, treatment of use disorders. I mean, it's a whole big, very specific law. And the reason that happened is that before that law went into effect, even if you were a prescriber of controlled substances, if you wanted to manage substance use disorder, which, the gold star, like the Taylor Swift of substance use disorder drugs, is buprenorphine, marketed as Suboxone. Well, buprenorphine in combo with, other is Suboxone. So in order to prescribe that for opioid use disorder, to manage substance use disorder, you had to have very specific 24 hours of CE and then be registered with SAMHSA, which is the Substance Abuse and Mental Health Society. You had to be approved and registered by them to treat use disorder. And in 2023, part of like new federal legislation really just wanted to make it available to everybody, because managing use disorder was like, to be a prescriber is so restricted. that many patients didn't have access to a prescriber. So in order to increase access to way more people of treatment for their use disorder, the DEA eliminated that requirement. You didn't have to have those 24 hours anymore, but they require now that all DEA registrants, whether you're going to treat use disorder or not, you could never, ever, ever manage a use disorder. But if you want to have and renew a DEA registration, you have to have 8 hours of CE. That includes education about like guidelines for pain management and various issues in federal guidelines, risk factor for a use disorder, just like a bunch of stuff. So there's that 8-hour requirement, which yes, not only do we here at FHEA do it, but I here at FHEA, me and my personalities, develop that program specifically to meet the requirements of that law. Because the law, most NPs that are prescribing really don't know what the laws that regulate their practice say. And I mean, no disrespect, I didn't either until at one time I was the DEA or the DEA, I was the APRN consultant for the Nevada State Board of Nursing. And it was my job to know the law and the administrative code and be able to point people in the right direction about it. And that's when I learned all the things that I didn't know in the law. So a lot of prescribers, they don't know the laws in and out. And the law on this DEA 8-hour thing, it's pretty involved. It covers a lot of stuff. So that's why, it was my job to develop a program that met that requirement so that when anybody takes that program, they can very comfortably click that box that says they meet the requirement.
Do you have to wait for that? Like, since we're talking about certification at this point, licensure, right? Certification, licensure, getting to be able to prescribe, making sure you have this training. Is this something that like an MP jumpstart on?
No, yeah, like anybody. Soon, I'm sure that soon schools of nursing will start altering their programs to make sure that their grads meet the requirements. Like I teach pharmacology at Drexel University and I'm working on it, but you can't just change a college course. It has to go through the appropriate committee. And where I teach has to go through the Board of Nursing, so it doesn't happen overnight. So I'd be very comfortable suggesting that right now, most schools probably don't offer that whole 8 hours that you need. But you can do it anytime. You do not have to be an NP. Like the DEA registers all sorts of people. Like they register pharmacies and research centers and like all kinds of stuff that's not like healthcare related. But yes, anyone can take that course. And then when you're filling out your registration application, you don't, it's not that you had to take those 8 hours after you were an NP. Or the question is just, have you had 8 hours, period?
Yeah. Okay. So looking at some of the comments, there's a lot of steps, guys. And yes, I will make sure that we have a printout of just the process. It's nice to be able to see this. So everyone who's on, you'll get that. Be happy to share that. Is there anything else that we're missing with training that you have to have around your licensure to prescribe? I know DEA, we spoke about that training piece that you spoke about, those 8 hours. Are those what's current right now for like, you need to make sure that these ducks are in a row for you to be able to prescribe specifically controlled?
Yeah, anything else is usually like states do have their own specific requirements, but they're actually usually much lighter than programs require. Usually everything else that you need from a state licensing perspective will have been covered in school.
Okay. The one thing I'm thinking of, just because we scrubs and subpoenas all the time, I'm thinking about insurance, like the malpractice insurance part. Is that something that's like way later, or is that I am certified, I'm licensed, I can prescribe, I've done all my training, I don't need to worry about that because I'm going to get hired in a hospital, and so they'll cover my insurance. There's nothing else that
No. In fact, I'd think about that before ever even seeing a single patient. And that's worth a convo, but I don't want to lose track of the NPI. Did you want to talk about that now or come back to it later?
Yes.
Okay. Yeah, the NPI has nothing to do with any of that. The NPI has nothing to do with nothing. The NPI, the National Provider Identifier.
Yeah.
That is basically, I don't know. I don't even know exactly the analogy to make. It's kind of like, I want to I want to say your social security number of being an NP, but it's got nothing to do with money. So it's not maybe it's kind of like your registration of being an NP. It's just a registry. The NPI, that's free.
Oh, something you
Hallelujah. You
don't
know,
have to
something
pay
is
for.
free.
That's
Yeah.
great.
You can get it when anytime you want. Like if you're not an NP yet, you can get an NPI as a nurse, I'm sure. I don't know why you would need it or why you would, but you know, once you are an NP in your state, you can do it yourself, or a lot of times the first job will do it for you. I would suggest doing it yourself, because if your job does it for you, you're going to have some silly username and password. Like my username is one of the first physicians I ever worked for. First initial, last name with a 1 after it. That's my username and I can't change it.
Oh my gosh. That's weird.
So yeah. So the way to get an NPI is to just you like Google the NPI enumerator, like, you know, capital N, capital P, capital I, space enumerator. And then it's like NPESS. I forget what that stands for, but you'll see it. And it's really very simple. You can just go online. It asks you some questions like your name, your license, your specialty, very quick, and then click, boom, and then you have your NPI. That's going to be the thing that is really attached to your professional identity for the rest of your career. Every job will require that you have one. So like if you don't have it, they'll get one for you. But once it's yours, and the username doesn't change. And then, I mean, really, anytime that you go to work somewhere, they're going to ask you for it. When you prescribe, they track by your NPI number, which is usually entered in the, you know, the electronic, like your info in the electronic medical record.
Yeah.
If anybody is still actually ever calling in prescriptions, like if your EMR is down and you're trying to call in something, they'll ask your NPI.
Okay.
And everybody just, I mean, you usually get to a point where you know it off the top of your head.
Okay, so it's just kind of like your own unique registration number.
Yeah.
To you the NP kind of has you there.
Yep.
Okay, that
Yep.
makes sense. That makes
Yeah,
sense.
that's kind of lateral to everything else we've talked about. You know, you've got the license, the certification, the board of pharmacy, the controlled substance, the DEA, and then over here, somewhere along the way, you just have to have an NPI before you go to work because an employer will want it.
Okay, all right. So walk us through real quick before we start to answer questions. We got a lot of great questions here. Just the process again, just a quick overview. Step 1, 2, 3, kind of how that goes, things that we have to be thinking about. Graduating, getting ready to practice. What do I need to do?
So the first thing is about state licensure, getting licensure in the state that you want to practice in. Simultaneously be applying to the board, the certifying board where you want to take your boards, because you will have to have passed a board to complete your licensure application in 47 states. And even in the other 3 where you don't have to have certification right now, most insurances will require it to impanel you. If you ever want to move, you'll need it. And more employers are starting to require it. So it's just smart to get it upon graduation. That's when you're best prepared to take your boards. So many people will say, I want to wait a little bit. I want to wait till I have some experience. Don't do it. Every practice skews in some direction. Even general practices, general family practices, they tend to specialize. Some will be more wellness, you know, like wellness kind of stuff. Others won't do peds. Some will be like more internal medicine. You know, everything tends to skew in a direction. So your best time to take your boards is when you first graduate from school. So licensure and board certification boards are basically simultaneous, but you do have to have the certifying board for licensure in 47 states. Then you apply to the Board of Pharmacy.
Got it.
And the Board of Pharmacy will ask you if you're planning to prescribe controlled substances. And if you are, well, then fine. As long as you're not a felon, they will license you to prescribe controlled substances. And then you will register with the DEA. And then the last thing you need to do before you go to work, is to make sure that you are covered by way of malpractice insurance. In this litigious world in which we live, I would not see a patient without making sure you are covered. Many employers will offer it to you,
Yeah.
which is great. But what you want to be aware of is that there's three basic types of malpractice insurance. There's claims made coverage, there's occurrence-based coverage, and then there's tail coverage. And there's a couple of important distinctions. Claims made coverage covers you as long as the policy is in effect when the claim is made.
Okay.
So you have to still have the policy when the claim is made against you. Claims made coverage is the cheapest coverage. So it's what employers will usually offer you. And it's what, when a new grad has to buy it after paying for their registration and everything else, when a new grad is looking at the prices, claims made coverage seems more appealing because it's cheaper. And it might have the same policy limits, like 1 million per occurrence, 5 million aggregate. Like that all might look the same, but claims made is cheaper because it only covers you if you still have the policy when the claim is made. Remember that there's a statute of limitations for malpractice cases. At a minimum, somebody can sue you 2 years after the event happens. And depending on the circumstances, in some states, some things are more. Okay, so hold that thought. Occurrence-based coverage is coverage that covers you as long as you had the policy when the event happened. So you might have canceled it, but something happened a year ago and you're just now getting sued over it. As long as you had the policy a year ago when the thing happened, it will cover you. So like how this bears out is, suppose you're just finishing school, maybe the organization you work for as an RN, they paid for your tuition, they paid for your MP. So you're going to work with them for like X number of years after graduation. And they say, okay, we're going to give you malpractice insurance. Ask them, is it claims made or occurrence based? It'll be claims made. They'll say, well, we're going to give you a claims made policy. Well, okay, if you plan to work there for like 5 years, let them pay for it for 5 years. But then if you leave there at the end of those 5 years, you don't have that policy anymore. So for the next 2 years, somebody can come back and sue you over something that happened while you were working there, and that policy won't cover you anymore.
Don't have it.
Unless you or them bought tail coverage. Tail coverage is a bridge policy that will cover you from the end of the claims made policy till the end of the statute of limitations.
Oh.
But it's pricey. It's pricey. So it takes, you have to think about it. Like if you've worked for a place for years and years and they paid for your NP and you're going to work there till you retire, you're happy. You're going to work there till you retire. Maybe you'll be there another 10 years or whatever. Let them cover the claims made stuff. You won't pay for any malpractice insurance for all those years. And then you quit, you got to pay tail coverage for 2 years. Well, those 2 years aren't cheap, but what you pay for those 2 years is a lot less than if you bought your own policy every year for 10 years. See what I mean?
Yes.
But if you're not sure what you're going to do, maybe you finish school now, you want to get this job, and you might be there a year or 2 or whatever, get occurrence-based. Just get occurrence-based. Because then maybe, you in a year or 2, you stop working, maybe you go back to school to get a doctorate, maybe you win $1 bazillion, maybe anything in life happens and you're not going to work anymore.
Yes.
But that occurrence-based policy will cover you if anybody sues you over anything that happened while you were there.
Okay.
I know that's confusing to a lot of people the first time they hear it. And if it didn't make sense, I'm happy to try to repeat something or walk through it again.
No, that's actually really good to know. I think so many times, especially from our conversations, we talk about malpractice insurance in kind of one way, not even all those pieces. So that's great. That's a really helpful addition, quite honestly, to this whole entire process of licensure. So I want to look at questions. We've got some good ones here. I'm gonna look at Q&A and the chat. So if you put them anywhere, we're good. I'm gonna start to read them out. Teresa was entertained with your story, so put that out there. Also shared that ANCC required a letter from my school's NP program head. So yeah, that makes sense to what Sally was talking about. All right, here's the first one. So how do you get a nurse practitioner license in another state For example, I'm in Texas and will apply for my Texas F&P license, but what if I want to move to California? How can I get my F&P license in California? I have already taken steps and do have my RN in California, but haven't worked at all in the state yet.
You know, it's unlike the RN license, which is usually easily not transferable, but almost every state, all you have to do is to send verification of a valid RN license, and then the next state will give it to you. MP is not like that. Every state is its own entity. So if you live in Texas and you want to be licensed as an NP in California, you got to go to California Board of Nursing website, download their application for NP licensure, and fill it out just like you were a new grad. The fact that you have an NP license elsewhere usually doesn't make any difference at all.
Okay. Okay, great. This one here from Charmaine, Texas, we have that one, Alexandria. So if your state does not require you to be approved by the Board of Pharmacy, are you good to prescribe as soon as you get licensure from your nursing board and register with the DEA?
If I would verify that with your Board of Nursing, if your Board of Nursing is the entity that authorizes prescribing and authorizes controlled substance prescribing, then yes. Then you just go, then your next step is the DEA website to register.
Okay. And then our next question here, I'm currently in Texas. How do I go about my steps for being able to register to prescribe? I am in a restricted practice state.
I mean, it's all according to what Texas will authorize. It very much comes from the State Board of Nursing. If you're not sure and you're really starting from scratch, virtually every Board of Nursing has an APRN representative that you can ask exactly that question. And listen, I know it's not easy because I was that person. Sometimes they're not in the office. You have to leave a message. Sometimes you'll sit on hold for 20 minutes or whatever. Sometimes it's easier to email them than call them, but you got to get a hold of the APRN representative from the Board of Nursing in the state in which you are licensed and ask precisely that question. I know that there is some level of prescribing in Texas because I've prescribed there.
Yeah, that's a good point. That's a good point about the alternative. All right, so here another prescription question. So as an NP, this just looks like, just to clarify. So as an NP, you have to be licensed by the pharmacy board in order to prescribe medications. To clarify.
That's state specific. That's state specific. So the place to start is with your Board of Nursing. Ask them, you know, straight up, ask them.
Very good. And then Alexandria is sharing about the DEA, which is great. Our program had us do 8-hour DEA training prior to graduation, which is exactly what we're talking about. You can do that. Highly recommends doing it sooner or asking your school, can they provide it or point you in that direction. That's probably a good idea to get a head start on that. All right, and then here from Jasmine, for NPI, if you do not have a job yet, what address should you put on the application since it's public information? And do you need to apply for a new NPI when you move to different states, or is it universal?
No, the NPI is universal. So once you have it, you have it. And if you don't have a job yet, there's no reason to apply for one. Like you'll do it. You'll get it the same day. Like, you know, you go online, you fill it out, you hit submit, and it will give you your NPI. So you can easily just wait until you have a work address to attach to it. And then as you, you know, as you change jobs, you just update the address with the NPI enumerator.
Okay. Michelle's asking where we can take the 8 hours needed for DEA. Well, luckily enough, you're looking at the lady.
Well, imagine that you had asked that question. Yes, Fitzgerald has a great course. I'm not making that up. I can't really say that since I'm the one that teaches it, but I'm reading what somebody else wrote. But listen, if I do say so myself, I do think it's a good course because it really does A, meet everything that the law requires of you. And B, I mean, it really infuses practical application. It's not just like, I'll tell you, when I, you know, here in Nevada, like, and when you take the course, you'll hear all of this again, but like this whole business of the opioid crisis and various requirements for managing substance use disorder really all arose from the opioid crisis of like the 20 aughts. And then a bunch of legislation started to emerge in the 2010s, and they just went nuts, and it's not doable. In Nevada in 2018, we implemented a bunch of laws that were born from this, and they were not followable. And when the law was started January 1st of 2018, a representative from the state legislature and a physician who advises them a lot made the rounds to do free education for all of us about this law. And the first thing they said is, you can't follow it. It's not followable. We know it's not followable. This is what happens when non-healthcare providers are making healthcare law. You know,
Yes.
like, you can't follow it, but here's the law. And then fortunately, at the next legislative session, they started to implement some corrections. These crazy laws were really a knee-jerk reaction to the opioid crisis. So, I mean, the reason that I think the course that we have is a really useful one is it helps with that bridge. You know, it really articulates, you know, the CDC guidelines and looks at some samples of some laws. And then how do we really follow this in the day-to-day?
Yeah.
I think it's a
how
good
does
course of it.
really show
Mhm.
up in real life. Yeah.
If I do say so myself.
It's
Anyway,
a
not to
great
sound like a
book.
commercial, because I'm really bad at that, but
No, but we
yeah, there's a
definitely
fly
have
in
that,
my,
Michelle. So if you're interested, we have that. What else do we have here? Address. I think you answered this, but maybe just to clarify, what address can you put on the NPI application if you don't want your home address on the internet? And it looks like Teresa said she uses a UPS store mailbox for this.
Mhm. Yeah, you could get a post office box or just wait until you have a job,
Yeah,
you know,
That's-
to add. Hmm.
that's an easy one. And I get it. I don't always want my home information all over the place with your licensure.
Sure.
It's public.
Sure. And a lot of people work virtually now too.
True.
And so their office is in their home, and they have like a mail drop for all professional communication and stuff.
Yeah. Yep. Tiffany's asking, do you put your job address? Yep. It looks like you can absolutely do that. That's totally fine.
Hmm.
Totally fine.
And then it's just if you when you change professional addresses. I mean, if you have a mail drop or a UPS box or something, as long as you have that box, keep that address. But when you change practices, if you use your work address, you should update it. Now that I think about it, I should look and see what mine is.
Yeah. No
Probably
kidding.
like 20 years ago, but yeah.
All right, excellent. Let me see if I have any other questions here in the chat. Just gonna scan, make sure I didn't forget anybody. Looks like we got everybody in the chat and the Q&A. Excellent. Tiffany asked one more question here about the address. It looks like, do you have to work in the US? Related if you're doing virtual.
Well, you're supposed to be licensed in the state or the sovereignty in which you are practicing. So if you're practicing virtually and you're seeing patients in another country, you need to know the laws of that country.
Yeah.
And you don't need an NPI in another country, because NPI is the national provider identifier.
Right.
So if you're working virtually and practicing in another country, it's really the laws of that country that you have to follow. Just like if you are working in another state, you have to follow the laws of that state. Now, if you are working in another country as a function of like a U.S. entity, like I can't even think of, like for an embassy or something, you know, but you're working in another country, but you are still as a representative and an employee of the United States, then you do have to follow the laws of the federal government, like you're working for the VA.
Yeah, that makes sense. And I'm looking at Tiffany just added here. It looks like maybe it's the reverse. So what if you're in another country, but you're seeing patients here in the United States?
Same thing. You have to be licensed in the state in which you are seeing patients. So if you are an international person,
Yeah.
and you're seeing patients in a state in the United States, you should be licensed as an NP in that state. If you are not licensed in that state and you are practicing, then you are subject to, you know, criminal prosecution for practicing without a license.
Okay. Well, hopefully you have the license there, right?
Yeah.
We were talking about the NPI.
No, we actually, when I was with the board, we ran into this once. I don't remember if the person was international or what, but somebody was practicing as a nurse, not a nurse practitioner, but practicing as a nurse, and they weren't actually licensed by the Board of Nursing. And it was really a challenge because the Board of Nursing only has jurisdiction over nurses. So if you're not a nurse, the Board of Nursing doesn't have any jurisdiction over you.
Oh my gosh.
But state agencies do, state like the state attorney general
Yeah.
does, and it becomes a criminal thing.
Okay, good to know. So that's good information to take. Let me just double check. All right, I don't think I see any other questions here. Awesome. So for everyone who did attend, we'll definitely put together a little process of what we spoke about, right? The kind of the steps that you want to make sure that you're taking. Certification, licensure, those are not the same things, right? Making sure that you have the right to prescribe, like you're registered with the board as you need to. You've done the DEA work, you've done your training. So absolutely put that together and send that out for you. And Thanks for joining. We hope that you all enjoyed this. I learned a lot that we are confusing as far as processes goes. It's like it doesn't get better, right? But this was super helpful to clarify all the steps that we have to take because there is a lot of steps to take.
Divide and conquer, one piece at a time.
Divide and
Yep.
conquer. Thank you all for joining, and thank you, Dr. Miller, for imparting this knowledge on us and really helping to
Always a pleasure.
clarify the confusion.
Like I said, I lived it firsthand, so I don't want anybody else to find themselves in the shoes I was in.
Absolutely.
Man, and I was doing stuff like I was in the OR.
We'll save that.
I was like putting in chest tubes and, putting in like subclavian lines and then putting in chest tubes after I dropped the lung and didn't know I wasn't licensed.
Oh my gosh. Have a great night, everybody. Thank you.
Bye-bye.